Dear student, second class, Mosul College of Medicine, University of Mosul. Assalamu alaikum wa rahmatullahi wa barakatuh. This is the fourth lecture in the specialized embryology of the gastrointestinal system. Bismillah ar-Rahman ar-Rahim. The hindgut. Look at this figure. This is the hindgut. Its extent to the level of the cloacal membrane. Again, this picture shows the hindgut, which is extend toward the cloacal membrane. The hindgut is the distal part of the gut, and it is closed by cloaca and has a connection to the allantois and to the cloacal membrane. It gives rise to the left 1/3 of transverse colon, descending colon, sigmoid colon, rectum, upper half of the anal canal. So the derivative of the hindgut is the left third of transverse colon, left colic flexure, and descending colon, and sigmoid colon, and rectum, and the upper part of the anal canal. These parts are supplied by inferior mesenteric artery, which is the artery of the hindgut. The terminal part of the hindgut dilate to form cloaca. What is the cloaca? The cloaca is the dilatation of the hindgut, and it is closed by the cloacal membrane. So this is the dilated part of the hindgut, and it is closed by the cloacal membrane. The cloaca received the three openings. Number 1, the allantois ventrally, and the two mesonephric ducts, one on each side. So this is one of the two mesonephric ducts. The relation between the hindgut and cloaca at the end of the 5th week is showed in this figure. So this is the cloaca, which is dilated end of the hindgut. This is the allantois, and this is the mesonephric duct, and this is the hindgut. The rectum and anal canal are the most caudal part of the hindgut, caudal to the origin of the allantois. They dilate and known as endodermal cloaca, with the cloacal membrane lying in the ventral wall. So this is the endodermal cloaca, and this is the cloacal membrane. Number 1, the endodermal cloaca is divided by mesodermal septum called urorectal septum, dividing it into two parts, the ventral part and the dorsal part. The ventral part called urogenital sinus, while here is the dorsal part, which is the upper half of the anal canal and the rectum. What are the steps in the development of the hindgut? Look at this picture. Here is the hindgut, and this is the cloaca, and this is the cloacal membrane, and this is the allantois, and here is the endodermal cloaca. Then urorectal septum, dividing the endodermal cloaca into two parts, urogenital sinus and the dorsal part, which is the rectum and upper part of the anal canal. Again, this figure, here is the urorectal septum. Number 2, at the meantime, the cloacal membrane is dividing into two membranes, the urogenital membrane and the anal membrane dorsally. Between them, there is what's called the perineal body. Number 3, the mesoderm surrounding the cloacal membrane is thickened and elevated, so the whole membrane comes to lie at the depression of the ectodermal cloaca. Number 4, the anal membrane becomes surrounded by anal tubercle, mesodermal proliferation that will form the external anal sphincter. Number 5, thus the anal membrane becomes at the bottom of the proctodium, anal pit, which gives rise to the lower part of the anal canal. This is the lower part of the anal canal. Then rupture of anal membrane happened, lead to continuity between two halves of the anal canal. So this is the lower part and this is the upper part of the anal canal. When there is rupture of membrane, there is a formation of continuity between two halves, and the site of the anal membrane represented in the adult by the anal bulbs. This is summary of the development of the hindgut. Number 1, formation of cloaca, which is common end of the hindgut and urogenital tract. And this cloacal membrane, this is allantois, and this is the formation of urorectal septum, and this is the hindgut. Number 2, formation of the septum, which is grow towards the cloacal membrane to dividing the endodermal cloaca into urogenital sinus and to the anorectal canal. Then the membrane dividing into two parts, anal membrane and urogenital membrane, and perineal body formed, separate the urogenital membrane from the anal membrane, and then rupture of the anal membrane to make a continuity between the lower part of the anal canal with the upper part of the anal canal. Again, this is a summary of the stages of the development of the anal canal that we are mentioned before. What are the congenital anomalies of the hindgut? Number 1, imperforated anus, due to the failure of rupture of the anal membrane. Number 2, congenital recto-vaginal fistula in the female. Number 3, recto-vesical fistula due to the defect in the urorectal septum formation. And number 4, rectal atresia, which is obliteration of the lower part of the rectum due to the replacement of the caudal part of anorectal canal by fibrous tissue. Look at this picture. There is a fistula between the urinary system and rectal system. So it is called urorectal fistula. So between the urinary system and the hindgut, so there is urorectal fistula. Look at this picture. This is what is called recto-vaginal fistula. This is vagina in female, and this is the hindgut. So there is opening between them, so-called recto-vaginal fistula in female. While this figure showed the rectoperineal fistula, here is the fistula between the skin of the perineum and the hindgut. This picture showed formation of imperforated anus. So this is the rectum, failure to rupture outside. So there is anal pit but without opening, so-called imperforated anus. Number 5, Hirschsprung disease, which is a birth defect. It is the most prominent symptom of this disease is constipation. So this is a baby presented with severe constipation, and he has a defect in the nerves that are missing from the part of the large intestine. So this is the normal intestine or normal large intestine, and this is the abnormal large intestine, where is the dilatation and dilatation of the sigmoid colon, leading to the constipation. This is the slide, histological slide of patient presented with Hirschsprung disease. So there is abnormal nerve fibers and nerve ending in the large intestine, which leads to formation of Hirschsprung disease, which is congenital abnormalities in the hindgut. Well, now it is the time for refreshment. Please give me your attention and try to answer these questions. Choose the correct answer. Number 1 or number A. The gastrointestinal tract arises initially during the process of gastrulation. B. GIT is derived from the ectoderm of the trilaminar embryo at week 6. Number C. It extends from buccopharyngeal membrane to the area beyond the cloacal membrane. D. The tract and associated organ later have contribution from one of the germ cell layers. So choose the correct answer. A or B or C or D. Regarding the foregut, number 1, the respiratory diverticulum gives rise to trachea exclusively. Number 2, the esophageal tracheal septum dividing the foregut into 2 portions. Number 3, the caudal part of the groove developed into esophagus and stomach only. I mean esophageal tracheal groove. So choose the correct answer regarding the foregut. Name the pointed structure. What is the name of this structure? Look at these anomalies. Which one of them is the most frequent type? A or B or C or D or E? Name the part of pancreas that is developed from the ventral bud, the dorsal part, the dorsal ventral bud and dorsal bud, and name the parts originated from pars cystica. Give an answer about the origin of hepatocytes, blood sinusoids, Kupffer cells, stroma and capsule of the liver. So what is the origin, or what are the origins of these 4 structures? Also, name the anomalies in these figures. What is the name of this anomaly, and this anomaly, and this anomaly? That's all about GIT embryology. Thank you for your attention.